Welcome to The Explainer. I am absolutely thrilled you're joining us today because we're looking at something truly fascinating. We're talking about the vagus nerve and how we can actually take an active role in regulating our own nervous systems. Seriously, if you've ever found yourself wishing you had a built-in manual for hacking your body's stress response, well, you are in the exact right place. We are going to break down the whole shebang, the science, the specific physical movements, and of course, the absolute must-know safety protocols.
So you know the feeling, right? You're running a few minutes late, you can't find your keys anywhere, suddenly the smoke alarm is going off because of some burnt toast. Or, honestly, maybe it's literally just a random Tuesday and you feel this overwhelming tension and anxiety, and you can't quite pinpoint why. Look, it's a completely universal human experience. But thankfully, we actually have this biological superhero built right into our anatomy that can help us hit the brakes on all that stress. And that superhero? It's the vagus nerve.
Okay, let's dive into this. Here is our roadmap for today's journey. 1. Meet your vagus nerve. 2. The polyvagal theory framework. 3. Everyday vagal exercises. 4. Targeted physical movements. 5. Risks and contraindications. And finally, 6. Building a safe routine. Starting right off with Section 1. Meet your vagus nerve, also known as the body's brake pedal. Now, before we can talk about stimulating this nerve, we really need to know what it actually is and where it lives in the body. So the vagus nerve is actually the longest of your 12 cranial nerves. It starts way up in your brainstem, and then it physically branches out, running all the way down your neck and connecting right to your heart, your lungs, and your digestive system. It's really best to think of it like a giant physical superhighway. You see, when your brain senses danger, and that could be a very real threat like a dog chasing you, or totally imagined, like stressing over a public speaking event, your body kicks into this massive fight or flight overdrive. Your heart races, your breathing gets incredibly shallow. Well, the vagus nerve is your biological brake pedal. When you activate it, you can take conscious control of that heart rate, your breathing, and your blood pressure, naturally forcing your body right back into a calm state. So how does this brake pedal dictate our day-to-day moods?
That brings us to Section 2, the polyvagal theory framework and our nervous system states.
To understand this, we look to the polyvagal theory, which was developed by Dr. Stephen Porges. It basically says our nervous system operates in one of three primary states. First, there's the sympathetic state. That is your classic fight-or-flight mode, right? Full of muscle tension, full of anxiety. Then there's the dorsal vagal state. This happens when we feel so totally overwhelmed that we just completely shut down, we freeze, or we feel totally disconnected from the world. But the state we are really aiming for, that's the ventral vagal state. When this system is active, we feel safe, we feel calm, we're socially connected. It is the ultimate rest and digest state. And our big goal for today is learning exactly how to consciously shift our bodies into that ventral vagal state.
Moving right along to Section 3, everyday vagal exercises and accessible daily habits.
The absolute best part about all of this, you don't need any fancy equipment. We are going to start with the single most accessible tool you have, which is just your breath. When we get stressed, we tend to take these really short, shallow breaths right from our chest, which honestly just fuels the anxiety. What you want to do instead is breathe deeply from your diaphragm, down in the lower part of your stomach area. You simply draw in as much air as you possibly can, hold it for at least 5 seconds, and then exhale very slowly, watching that diaphragm rise and fall. Doing this rhythmically acts as a direct physical massage to your vagus nerve. It literally calms your system down with every single exhale.
Now, beyond breathing, there are some surprisingly simple everyday lifestyle habits you can adopt. Just splashing some cold water on your face or taking a brisk cold shower immediately slows your heart rate and redirects oxygen to your vital organs, which gives you this great release of feel-good endorphins. Also, because your vagus nerve reaches your vocal cords, doing things like humming, chanting, or even just belting out your favorite song in the car shifts your physiological focus and helps that stress just fade away. Meditation and gentle yoga work absolute wonders too. But my personal favorite, a really hearty belly laugh. I mean, we're not talking about a polite little chuckle at a dinner party. You need a deep, side-splitting laugh with a good friend or a hilarious movie to really get in there and stimulate that nerve.
Let's look at Section 4, targeted physical movements to soothe the nervous system.
Now, what's really interesting about this next part is how we can use very specific physical maneuvers to manage anxiety and even help with symptoms of ADHD. There is this incredible connection between our eyes and our nervous system. This maneuver is known as the basic exercise, and it's inspired by the work of Stanley Rosenberg. It operates on this totally fascinating principle that just lateral eye movements, moving your eyes side to side, can actually influence your autonomic nervous system. It sends a direct signal right to your brain saying, hey, you are safe. For anyone dealing with heightened stress or ADHD-related anxiety, this can be an incredibly grounding tool.
And the mechanics of this are so simple. You just sit down or lie down comfortably and interlace your hands behind your head to give it some nice support. Then, keeping your head perfectly still, you look to the right with just your eyes. Hold that gaze for about 30 seconds. Then, you bring your eyes back to the center, relax for a quick moment, and repeat the whole thing by looking to the left for another 30 seconds. That's it. It gently stimulates the nerve and helps regulate that wonderful rest and digest response we talked about earlier.
Next up, we have a really cool adaptation of that concept. It's called the seated salamander exercise. Listen, if you're someone who carries all your stress and physical tension bundled up in your neck and shoulders, which, let's be honest, is so many of us these days, this one is fantastic. It combines those same calming eye movements we just learned with a very gentle neck stretch. So you're releasing physical tension while simultaneously soothing your mind.
Here is exactly how you execute the seated salamander. Sitting up nice and straight in a chair, you're going to slowly tilt your head down towards your right shoulder. But here's the trick. Keep your eyes perfectly level and look over to the left. So you hold that combination, a rightward head tilt but a leftward gaze for about 30 seconds. Then bring everything smoothly back to the center and simply repeat it on the opposite side. It actively increases your vagal tone, and it is absolutely brilliant for recovering from a moment of acute stress.
And finally, for our physical movements, we have the Sphinx with head turn. This one combines physical stability with that vagal stimulation to really cut down on mental chaos. What you do is lie flat on your belly with your forearms resting on the ground, sort of like the Sphinx pose in yoga. This gently opens up your chest and immediately improves your breathing. From that stable, lifted position, you just slowly turn your head to the right, hold it for 30 seconds, come back to center, and repeat to the left. It's incredibly effective at clearing out brain fog and easing that physical restlessness we get when we're stressed.
Now, moving to Section 5, Risks and Contraindications, the Medical Realities.
Okay, as enthusiastic as we are about these exercises, we do need to slow the pacing down for just a moment to look at the very serious medical realities here. Because the vagus nerve directly controls your heart rate, stimulating it is not completely without risk for everyone. When we neutrally contrast these at-home maneuvers with actual clinical interventions, the differences are stark. Things like deep breathing, cold exposure, or those gentle eye movements are generally very safe for the vast majority of healthy adults, though, I should mention, they can occasionally cause a feeling of faintness or pre-syncope in some people. On the flip side, clinical interventions like surgically implanted devices for epilepsy or depression, or transcutaneous auricular devices that stimulate the nerve through the ear, those carry real surgical risks. We're talking potential interactions with other medical devices and documented side effects like hoarseness, persistent coughing, and throat pain. It's also absolutely crucial to note that certain populations require heightened caution. If you have severe aortic stenosis, if you've had a recent stroke or a heart attack, or if you have an implanted pacemaker, you really need specialist medical oversight before attempting any form of vagal stimulation. Additionally, and this is a big one, if you are taking rate-limiting drugs, things like beta blockers or certain calcium channel blockers, you must be incredibly careful because those medications are already actively lowering your heart rate. Adding vagal stimulation on top of them can cause a severe and potentially dangerous drop in your heart rate or your blood pressure. Also, I want to draw your attention to one specific maneuver, the carotid sinus massage. The medical guidelines are incredibly explicit about this. This is strictly for monitored clinical settings, usually performed by a doctor to treat an acute heart arrhythmia. It is absolutely, unequivocally, not a wellness technique for you to try at home. Doing it improperly, especially if someone has undiagnosed carotid artery disease, carries severe neurological risks. So please always stick to the gentle, approved breath and eye exercises when you're at home.
All right, wrapping up with Section 6, Building a Safe Routine and Practical Application.
With all those important safety parameters clearly established, let's talk about how to actually apply this. The absolutely crucial point here is consistency. As our sources emphasize, women managing ADHD, and really anyone dealing with chronic heavy stress, often experience a deep, long-term dysregulation of their nervous systems. Rewiring those old physical patterns takes a bit of time. You can't just take one deep breath on a Tuesday and expect lifelong zen, right? You really need to build a routine. Try keeping a simple daily practice log. Note how your body feels before and then after doing the basic exercise or the seated salamander. Because over time, this regular practice helps to deeply calm the nervous system, drastically reduce your baseline anxiety, and clear out all that internal chaos to vastly improve your daily focus.
So, I want to leave you with a question to think about. Right now, in this exact moment as you're listening, are you in that safe, calm ventral vagal state, or is your sympathetic fight or flight system quietly running the show in the background? Just having that awareness is the very first step. And now that you have this structured toolkit, everything from mindful diaphragm breathing to the Sphinx pose, you literally have the power to consciously shift your own biology. So what tool are you going to use today to bring yourself back to balance? Thank you so much for joining me for this explainer, and I really hope this helps you find your calm.